And Judith, the floor is yours.
Thanks so much. And thanks everyone for joining us this morning for an immigration policy update. And we'll be sharing a lot about how this impacts folks living with HIV and why it's so important to keep an eye on some of this legislation. Today, we're joined by Alianza Americas and Yanira Arias, who is the National Campaign Manager. We'll be sharing some call to action, but before that, Mony Ruiz Velasco, who's the Associate Director for Network Power at Alianza Americas, will share a comprehensive look of what the immigration landscape looks like today. Followed by that, we'll have Joaquin, who will also share another call to action. There's a lot going on, and it's important for us to discuss how health policy is impacting our communities, our immigrant communities. We've seen the news, some very startling information about what's happening to children at the border, but also the amount of deportations that have occurred in Biden's first few days, primarily targeting the Black community. So we want to really highlight what's happening, in this current state. So I want to turn it over to Mony, but before I do so, I just want to remind folks that for much of this, it's really about how some of these policies can impact and change how people access healthcare, the availability of healthcare programming due to status changes, the affordability in terms of being able to access health insurance with changes of status, but also how negatively some of these anti-immigrant policies can be in the rhetoric and the impact that it has in our community. So with that, Mony, I'll let you get started.
Thank you, Judith. Thank you for having us today. I think, this is in this kind of constantly changing world of immigration, there's always confusion and, there's just so much happening. Some of the stuff that we're going to cover today is more focused on the legislative side, but there is still a lot that is happening and can happen on the administrative side. So the things that the Biden administration can do, and we're going to talk a little bit about that in the context of public charge. But if you could switch the slide for me. Thank you. So just a little bit about Alianza. We are a national network of more than 50 organizations across the country, and we're working to create more inclusive and equitable, sustainable way of life for migrant communities in the US and across the Americas. We have staff also in Central America, so our work is transnational. And we partner with many organizations, and we, our members, our work really is devoted to our members and how we work together with our members to improve the lives of all of our communities. If you could go ahead and go on to the next slide. So a little bit about immigration policy that I think it's important to remember is that we haven't really had favorable immigration laws in a very, very long time. In more than 30 years, Congress hasn't passed anything favorable. And I think sometimes we forget about that just because there's so much always moving and changing. Most of the things that we have seen have been at the administrative level, which hasn't been that much. The last time there was a big kind of, bill that changed immigration law was really in the 90s, and it really changed it against immigrant communities. It made it worse. It made it harder for people to obtain legal status. In 1996, a law was passed that criminalized migration. And so that was the last big reform of our immigration laws. But since then, there hasn't been a lot of movement in Congress. And I always like to remind people that keeping people undocumented and kind of creating the circumstances that we have for immigrant communities right now has been a bipartisan effort. So it really has been something that neither party has prioritized at least to benefit immigrant communities. Neither party has prioritized immigration policy or invested the kind of political capital that it takes to move legislation forward in a, obviously in a way that benefits communities. So we're in this moment right now where, there's been all these lessons. I think we are in a different moment in that the world has changed in a lot of ways, I think, in the last few years, and especially as it relates as to looking at immigration as a racial justice issue, which it is. And also in the context of climate change, there are a lot of, so we're looking at things, I think, more holistically, just as a whole. And I think that there are some potential avenues for some change, hopefully. So, yeah, so if you could move us forward, Judith. So we're going to talk about a series of bills that are currently pending. And I think just to kind of take a step back, for those who aren't as familiar, in order for something to become law, there's two parts to Congress. It has to go through Congress. So the president can have, can say and whatever he wants to say, and he can have an intent and support different things, but the president can't change the law, and only Congress can do that. And it has to go through both chambers, both sides of Congress, both chambers. So it's the Senate and the House. So some of these bills are either in one side or the other. There's only one that has there's two that have passed one house and or one side and have gone to the other. We're going to talk about that. And then it would have to, the same version of the legislation would have to pass both sides, so that then it gets sent to the president for signature. That's the only way. And I think another important point to remember is, at least at this moment in time, most of these bills in the Senate require 60 votes to pass. And we have, at least right now, there are 50, it's split evenly, 50 Democrats, 50 Republicans. So in order for any immigration bill to pass at this point, we would have to have every single Democrat and at least 10 Republicans. So as you can imagine, that is a big challenge in this moment, and it's hard to see how we get there. And as we move along, I'll talk a little bit about some other ways that things may move forward, but that is the general rule at this point in time would be that we would need 60 votes. So I'm going to start with this bill. The U.S. Citizenship Act is a bill that has been introduced both in the Senate and in the House. Oops. There we go. Thank you. And this bill is really the concept that, this is the actual bill, but this is what President Biden kind of promised that would be introduced in his first 100 days. And so as he was campaigning, he was saying he was going to do change immigration law and get people into a position to obtain legal status. And this bill is that. And this bill it would provide some sort of pathway so people could apply for a green card and then eventually citizenship for the majority of people living in this country. It really is different and innovative in some ways, because previous versions of this kind of legislation always try to increase more funding and more detention, more deportation. It had like this really big negative piece to the bill, because that's, I think, what oftentimes the Democrats saw as an opportunity to bring Republicans on board. This bill doesn't really have that. It does adds more kind of surveillance and new technology at the border, which is not ideal, but compared to other versions, it's a much better version of that. And then it really changes the immigration system to address some of the backlogs. There's some people who are waiting over 30 years to be able to migrate through a family petition or through a relative, and this bill would eliminate those backlogs. And it would also create just much more protections for people. It increases the number of humanitarian visas, like U visas. It reforms asylum law in some ways, or it touches some on the asylum law process as well. So that people, and then it gives additional protections to workers. And so it's a really good piece of legislation. The reality is that most people really see this bill as an idea and maybe a goal of where we want to get. But the reality is that most people don't see that this bill in the way it is would ever advance to become law, at least not at this point. But I think it's still an important piece of legislation in that it's something this good, at least from our perspective, has never been introduced before, and especially not with the backing of the White House. So I do think it's advancing at least a narrative, which I think is also an important thing we have to advance. But this piece of legislation is pending on both sides, in the House and the Senate, and there may be some discussion on this bill coming up in April. So we're still waiting to hear if they're going to do it or not in the House, but they are thinking about voting. Right now, our understanding is they don't have the votes to pass it, and so then they probably wouldn't advance it. But that's where this bill is. So if you could advance to the next slide, Judith. Thank you. So then there's the DREAM Act, which I'm sure probably many of you have heard of before. And the DREAM Act has been introduced multiple times for the last 20 years. So it's been a bill that has had a lot of opportunities to pass, and unfortunately has never passed. But the DREAM Act would provide status, permanent resident status, for about 2 million people, including DACA recipients, but not just DACA recipients. It also includes other folks who didn't necessarily meet all the requirements of DACA, but it's for people who came to the U.S. when they were kids. It also has gives some people more, it opens up the door for DACA. There's about less than 1 million people who benefited. So this, almost doubles the population of people who would benefit. This bill is pending. This is Senator Durbin's bill, and Senator Graham. Senator Durbin has, like I said, introduced this bill for the past 20 years. He's in a really key position right now because he's the chair of the Judiciary Committee, which is where in the Senate where all these bills come through. But again, there's no path to pass this bill out of the Senate unless they can get 60 votes. So I think that's another piece that's important to consider. This bill has not been voted on at this point or advanced through the committee. And so it's just pending in the Senate. So if you could advance to the next slide, please. Okay. And then we have the Dream and Promise Act, which is a bill that was introduced in the House and in the House, and it's passed the House. And so this bill combines the Dream Act and another bill that we're going to talk about next, which is called the Secure Act, basically, which is a bill this bill gives protection to about 4 million people, as you can see on the slide. It includes the protections of the Dream Act, and it's actually broader than the Dream Act in that it basically everybody who's been living in the U.S. since 2021, January of 2021, and who entered the country under the age of 18 would benefit, and then meets these other high, school requirements, would be able to benefit from this protection. And so that's the broadest version of that particular part of the law that we've seen. It would also give an opportunity for people who have TPS or something called DED, who are generally folks who have lived in the country for decades, to also have access to permanent status, to a green card, and eventually to citizenship as well. And it provides legal assistance funds, so it has some other provisions. This bill, though, does have some provisions that concern us that excludes some people, right? And it primarily has to do with people charged with certain crimes, or people also who have been kind of categorized potentially as having involvement. They call it public threat, where there are public safety threat. And some of that, they consider some factors like, gang membership. And one of the concerns I think that's important to highlight is that what we have seen, and there's been a lot of written studies as well as, materials on this, is that the way folks are categorized as being in, when generally the police categorize people as someone being in a gang or not. And what we have seen is the majority of people classified that way are people of color, primarily Black and brown folks. And also that it's oftentimes, in a lot of these gang databases that exist all around the country, oftentimes it's without any basis in anything other than a person's opinion. So we've seen, there was a bill there was a gang database in California, for example, that had kids as young as like 2 years old that had been put into the gang database. People aren't given any notice. There's no due process connected with that. And so anything that would exclude people from a permanent protection based on something like that is really, really problematic, because people have no way of challenging that or even knowing who's in there and who isn't. So that's a big concern with this bill. But other than that, the rest of it is a good bill. It would protect, a good number of people, over 4 million people. And like I said, most of these folks have been here for decades that are basically already permanent residents, but for their status. They've established their life here. They have their families here. So and this bill, like I said, has passed the House. It's been sent over to the Senate, and our understanding is that it will be voted on. It doesn't have to go back through committee, which is a general process. It'll go just for a vote at some point in time. We don't know when. So if you could move on, please. Okay. The Farm Workers Modernization Act was also a bill that was introduced in the House and passed the House. And this bill is the most bipartisan of the bills. And it would benefit people who've been working in agricultural industries, farm workers and their immediate family members. And it would also reform the H-2A visas, which is kind of temporary visa that exists for certain workers that come from outside the US to work here in the US. And it's a visa that many industries rely on for their workers, like agricultural or like dairy farmers, and the different kind of industries that rely on this kind of visas for their workers. So it would reform it, make it more user friendly both for employers, but also just kind of addressing some of the challenges that exist with it. So that this bill, like I said, that it had the most number of Republicans who supported this bill, and it's now also been sent over to the Senate for a vote at some point in time. So we could move on to the next one. And then lastly, the Secure Act. This is another bill that is pending in the Senate, and it has not been voted on yet. This bill would give people with TPS, which is temporary protected status, and DED holders the ability to apply for permanent resident status and eventually U.S. citizenship. It would also include the spouse and parents and children of the people who have TPS and DED status. It's a bill that was introduced by Senator Van Hollen and Senator Cardin, and we are actively working on this bill to try to get it to move out of committee. It hasn't been voted on. It's like the DREAM Act, pending before the Judiciary Committee, and we're waiting to see what happens with it. So this is another bill that it's an important piece of legislation that protecting communities who already have a protection, but it's not a permanent status, and it's communities who have had to continue to fight and advocate for their own, temporary protection that they've had over the years. So I think that covers the last of the bills that we wanted to talk about. And I guess at this point, what I would say is that these are like I said earlier, these are the legislative efforts. So this is the stuff that's going on in Congress, the stuff that we need congressional approval for. And then there are a lot of other things that the president has the authority to do. Some he has already done, and many he still has yet to do. And we've been continuing to advocate, and I know Yanira is going to talk more about that, for both the administrative changes as well as these legislative changes. I know, Judith, we're going to talk a little about public charge. If you want to go on to the next slide. So I'll talk about this and then stop here. And this is not on the this is not on the congressional side. This is on the administrative side. But I think this is an issue that impacts obviously folks around the country. And public charge is, just to kind of go back, is something that has existed in the law for many, many years. It's not a new thing. It's not something that Trump created. It's what the Trump administration did was that they made it they redefined what public charge was so that it made it more difficult, primarily for people to immigrate, primarily for people who were more vulnerable. So people who were low income, children, people who had a disability, or people who were elderly, people, who couldn't basically show that they would be able to work and support themselves if they were allowed to immigrate to the United States to obtain permanent resident status. I think one important thing about public charge that there's always a lot of confusion about is that this particular rule or this particular issue only comes up at the moment that you're applying for a green card. So if you already have a green card and you're applying for citizenship, public charge is not relevant. Or if you're applying for a green card based on humanitarian protections like asylum or a U visa or something like that, public charge is not an issue. It's really an issue for people who are applying for a green card based on family relationships, right? Just primarily that's the main way. And there was a lot of kind of back and forth around this rule. So this is something that from the beginning of the Trump campaign, he started talking about public charge and saying how they were going to change this rule. They were going to make it harder for people to immigrate. And there was a lot of talk about how they were going to do it. It wasn't until like his third year in where they actually published a rule, a proposed rule. And in order to change these kinds of things, because it's not something that has to go through Congress, they had to propose a rule to change the way it had been defined before. And so they published that rule, and there was litigations. There was a lawsuit. There were actually several lawsuits that were filed against the administration saying it was the wrong interpretation of the law, and that they were, this was also race-based and discriminatory in the way they were doing it. And the litigation has been successful so far. It's now at the Supreme Court, but the Biden administration has committed to going back to the way things were before the Trump rule. They've kind of put a pause on the litigation. And actually one of the significant things that they did recently is that the Trump administration had published a new form that people had to use to submit with their green card applications that was consistent with their interpretation of public charge. The Biden administration just rescinded that form. So they said, we're getting rid of that form, go back to the old form because they're using the old standards. So I think with any of these changes that we're seeing that are positive changes coming from the Biden administration, the biggest challenge is making sure that the agencies are properly applying the rules as the Biden administration wants them to. And I think it's the same thing we're seeing with ICE, who isn't necessarily following the priorities that the Biden administration has put out. So it's really a job of the Biden administration to ensure that their agencies are following their guidelines. And, obviously it's our work to have some oversight over that as well. So I will leave it there. And I'll just see, Judith, what you want to do next.
Yes, thank you, Mony. And so I think some important things to note is that DACA recipients were not eligible to enroll through the marketplace, through the Affordable Care Act. They're not eligible. And so the DACA allows folks to obtain private insurance through their employers, same with folks with temporary protected status. So we can see how, however, there are folks who are DACA and TPS recipients who cannot access healthcare through their employer, either because they're contract workers or they work in service industries that traditionally don't provide health insurance. And so, we want to ensure that folks have access to health insurance, because that's one of the major barriers in folks accessing preventative care, and particularly for HIV, is establishing regular routine health care. And I'll also share that in terms of public charge did not necessarily include some of the treatment for people living with HIV, right, as a barrier for folks to receive. It didn't denominate things like using the AIDS Drug Assistance Program or Ryan White. However, people are whole people, right? Like, just because you are receiving healthcare and medications for one condition does not mean that folks do not need other forms of healthcare, dental care, right, vision. And so what some of this back and forth does is that it does create doubt that in communities where they may not want to go and access healthcare because they don't want their information in systems, they don't want this to impact their ability to maybe in the future regularize their legal status in the US or make changes. And there is a lot of confusion, particularly when these things are happening, even for us advocates, to keep track of what does this mean. So we're going back to this. And so if it is hard to keep up with some of this legislatively and the policies, imagine for communities just receiving information from media sources that can sometimes be very incendiary. And so I'll leave it at that to see if anyone has any questions from Mony regarding any of the potential legislation or around public charge. Oh, and one more thing I'll add is that DACA recipients are in the age range currently for where folks in the Latinx community are seeing the highest rates of HIV. And so when we think about who is being impacted, it is folks who would have fallen, who are in this age group. There is some overlap. And if from the beginning folks were eligible for the Affordable Care Act, I think we could have made a real impact on what that status or what those numbers look like. So if anyone has any questions for Mony, she is going to have to run soon. So really take advantage of this time. And you can put them in the chat or just speak up. So I'll give a few moments in case anyone has any questions.
Mony, can you help us understand the difference between TPS and DACA? Because I know we have mentioned TPS a couple of times, and DACA is a little bit more well-known.
Yeah, so TPS is temporary protected status, and DACA is many of you know, I think that was, got a lot of attention, is Deferred Action for Childhood Arrivals. DACA, let me start with DACA. DACA is, and I know there was a lot of confusion about this too in the beginning, DACA was not an executive order, even though a lot of people kind of refer to it that way, even sometimes politicians refer to it that way. It was just a policy change. So it's not based on a law, it's just based on a policy decision. And so all DACA is that at that time, the Obama administration said, we are going to deprioritize people who meet these requirements, and there were the requirements of DACA, kids who were at that point, it was people who had entered the US when they were less than 16 and who had lived in the US since 2007, et cetera, for deportation. And as a matter of discretion, we're going to allow them the opportunity to apply for a work permit. And what that means is that then once you get a work permit, you can get a social security number. In some cases, they were, if people applied for a permission to travel outside the country based on certain limited circumstances, they were also given permission to travel abroad, which is called advanced parole. So that's what DACA is. It's really just a policy change. It was issued in a memo. It wasn't like a law or a rule. It was just a policy. So as you can imagine, with a policy like that, it could come and go easily, right? Depending on who's president. And we saw some of that with President Trump. And in fact, there is still litigation pending. There's a lawsuit pending in Texas that could undo DACA still even today. So that's important to also highlight. Temporary protected status is different. It is based in law. So there was a law that passed in the 90s, in large part because Salvadoran communities organized to make sure that law passed. And it passed to say people who are from, or not people, the US government has the authority to designate certain countries for temporary protected status if there is maybe like a natural disaster, or there is a civil war, or there are, a pandemic actually is one of the reasons that a country can be designated for temporary protected status. So it's based in law, but there's still a discretionary element to it. And it allows people for 18 months at a time to have a work permit as well, have permission to travel outside the US, and be protected from deportation. Now, one thing with TPS is just like with DACA is that it doesn't lead to any permanent status. So people every 18 months for TPS and every 2 years for DACA have to apply to renew that protection. And as Judith said, it doesn't qualify people for, for kind of health insurance, access to the ACA or other protections. Now, I do want to say that those things can also be impacted state by state. So there's a lot of good state advocacy that can also happen. And some states do allow people with DACA to have access to some health insurance, kind of state-sponsored health insurance protections. And so I think that that's another kind of area of advocacy where work can happen to protect more communities, even if the federal government doesn't do it.
Great, thank you. And so it doesn't look like anyone threw any questions in the chat. So why don't we move on, Yanira? Wait. Oh, someone asks, who and what entity determines the eligibility for TPS? And so we saw a change with Venezuela very recently. So if you can share a little bit about that.
Yeah, so the TPS determinations are made by the Department of Homeland Security, oftentimes in consultation with the State Department. So those are the two kind of big agencies. Obviously, the White House has input into that as well, but the official designation comes from the Department of Homeland Security. Yeah, and then they have to make it again every 18 months, like I said. So,
and I think one important thing to note is that TPS has been sort of reauthorized year after year. And so for many communities, it's no longer really that temporary, right? Like you've established a life here, which is why it makes it so difficult when the Trump administration attempted to end temporary protected status and did for some countries, left folks having to move back to home countries that they had no relationship with, where they had children here, marriages, and it was just very difficult.
Yeah, and I think just with TPS, like with DACA, there's litigation still pending on that. So there's a lawsuit that's actually also at the Supreme Court now because it's gone through all the courts. I think one important thing to think about TPS, and I think is that the historical way of how they considered redesignations was not just based on the conditions that caused the reason for TPS, but like what has happened in that country since, right? Can the country like all of a sudden take in all these new people, all these people back who have been in the US for so long? Or can, are conditions stable enough so that, people would be safe to return, right? And I think unfortunately for the majority of the countries that have had TPS, the answer to that is no. One of the reasons that there was litigation and the Trump administration kind of argued that they could end TPS was that they said they were going to only look at the conditions at the time that TPS was granted. So for Salvadorans, for example, it was in 2001. So they were going to say, well, the conditions that existed in 2001 don't exist today, but they didn't take everything else into consideration that has happened since then, which is unprecedented, really. And so I think sometimes, when we're advocating for things like a new designation of TPS, people say that like, well, TPS is supposed to be temporary. Like, this is kind of like a radical ask. And I think what's radical really is what the Trump administration did, because it really departed from everything we've ever done in the history of like TPS and try to change it to some other made up interpretation. And so I think it's important to remember that context. Because, and thankfully, there was litigation to stop many of the things they tried to do, but they did pass they did make more than 600 changes to immigration policy without passing a single law. So I think that's important to remember, that just like he had all that authority and power to make all of those terrible changes, we now need to make sure that the new president uses all that authority and power to make good changes that will benefit communities. So I'll leave it at that to transition into the better part.
Great, thank
you.
you. Yanira?
So I just posted in the chat, there is an event today actually making a transition from what Mony just shared with us. This afternoon, Senator Chris Van Hollen is going to be hosting a live conversation with a couple of leaders from the business sector, faith leaders, and including TPS holders. I am a TPS holder, actually, from El Salvador. And he's going to be as well inviting leaders from Venezuela. He will be announcing some amendments to his bill, the Secure Act, to make sure that Venezuelans that now currently can apply for TPS and DED, which is the Deferred Enforcement Departure, another relief that exists within the immigration programs. He will be announcing that the changes will include the Venezuelan community in order to make sure that they are not just protected, but also engaging elected officials that have been closer to the idea of providing some sort of relief for Venezuelan communities. For example, the Republican elected officials who have been closer to the Venezuelan community. Senator Van Hollen is hoping that this is an opening for a larger conversation and get the 60 votes that he needs in order to pass the Secure Act. And so far, the panorama doesn't look well if we don't have a co-sponsor who is a Republican and also the 10 votes. So we're going into that right now. So thank you, Mony, for explaining all the information that you just shared. And we know there's a lot happening out there, including the executive orders and memos that have been issued in the past 70 days, more than 70 days from now with the new administration. As Mony mentioned, we are a national network comprised of immigrant-led organizations. Each organization is not only led by immigrants, but mobilizes, organizes, educate, and empower immigrant communities across the United States. We are present in 15 states, including the District of Columbia. And we have, as Mony mentioned, over 50 organizational members. So from day one of the Biden-Harris administration, we decided that we needed to take action. They just announced that they have an agenda for the first 100 days. So we also launched our minimum agenda for the policy recommendations and demands that we have for the current administration and the 117 Congress. So we came together with the membership of Alianza Americas, and we decided that first of all, we had to use the most powerful resource that we have, our voice. And also that we needed to act collectively in order to be effective, communicating our demands, but also putting pressure into elected officials and the Biden administration. For that, we also identified that we will need to do a lot of education. Just this quick review that Mony did about the several bills in both houses, we have been doing that for the past 70 days plus. On a weekly basis, every Tuesday night, we'll be meeting for 1 hour and a half, discussing what's happening every week, every day that something is happening in Washington, D.C. So on Tuesdays, we've been convening with our members, trying to make sure that everyone understands what it means, not just the memos, the policy changes, the bills, and also the opportunities to continue to educate elected officials. Advocacy has been a very strong component, but in order to advocate, we needed to, again, as I said, educate our members, educate allies, and educate elected officials. We've been asking our members, Alianza Americas members, to make sure that they schedule meetings with their elected officials to discuss the several policies, not just the immigration policies, but also those related to COVID-19, the several COVID relief bills. So we've been very concerned for the ongoing exclusion of immigrant populations and loved ones of undocumented people who have been consistently excluded from receiving relief. To this day, there are still millions of people excluded from COVID relief. And we have been pushing since the beginning of the pandemic, along with several other organizations, to make sure that we educate Congress about that good policy is a policy that promotes equality, not exclusions. So for the past 70 days, We have been recycling a lot of the messages that we have used back in 2020, but now in a more consistent and cohesive and a collaborative way with several organizations, including allies from Alianza Americas. Next slide, please. And this is what we want. This is just a brief summary of what we designed, what we drafted along with the feedback of our members. What you see here is the result of consultations with Alianza Americas members, but also with allies, in order to communicate to the Biden administration and to Congress what do we want to happen, not just in the first 100 days, but along the implementation of the actions of the current administration and the new Congress. We want to be adopted a pro-immigrant and pro-migration narrative. It is great to see that the current president is leading to educating, changing the way how elected officials in communities across the country speak about immigrant communities. But also we want to make sure that the narrative of hate, the xenophobic narrative, the racist values, and everything that have been criminalizing, demonizing, and creating fear against migrants and migrant people, it's forever erased from the United States. So for that, we are again engaging our members, Alianza Americas members, in how we can better communicate and humanize the stories of our communities, but also how that narrative impacts public policy. The second item that we are communicating to is to decisively asking President Biden to use his authority to protect migrants in vulnerable situations. And here is from the memorandums and executive orders that he has been using, not just for changing what's happening at the border, making sure that the asylum program it's come back to shape and to open the doors to protect those who are seeking safety in the United States, but also to make sure that asylum seekers have the right to seek not just protection, but to counsel and for their cases to be heard on a court. We also want that the administration provide unequivocal support for legislative proposals passed by the U.S. Congress aimed at reforming the U.S. immigration policy, meaning all of these policies, all of these bills that Mony just shared, we want the Biden administration to speak up in support with those that help us advance and modernize in a more humane way the immigration system. We want as well the administration to support broad legislative reforms in the economic and social spheres that benefit low and middle income families. Everything that we see, the impacts of COVID-19 is just opening the doors to how inequality works in the United States. We know that Black and Brown communities are the hardest hit by the pandemic. So this is why we're calling the administration that if we want to defeat the pandemic, we also need to reform how the economy works for low income and middle income families. And the last set of demands that we have for the current administration is to reorient the U.S. foreign policy towards Mexico, Central America, the Caribbean, and the rest of Latin America. Everything that Mony mentioned regarding the policies to provide immigration relief, it is connected also in the foreign policies of the United States towards the region. Every single person who have migrated, who have been forced to leave their country, the reason is not only because they need to look for employment or to bring food to the table for their loved ones. There are several issues affecting Central America, climate change, trade policies, militarization, the criminalization of youth, the attacks against indigenous communities, and several other issues are connected to policies that the United States and governments in the region agree to implement. So we know that anything that governments in the region do has a ripple effect also in the United States and vice versa. So we are asking that if we are speaking of root causes of migration, we look from the angle of civil society and not just the angle of the government. For example, we have high concerns in governments such as Honduras and Guatemala that there are proofs of corruption and systemic violence, and the United States continue to support this government. And there is also evidence that from these two countries, there is high migration because people is being forced to migrate due to that systemic violence and corruption. Next slide, please. How we are taking action. COVID-19 is pushing everyone, just like right now that we are connecting via this webinar. We are expanding that knowledge to make sure that every single person has access to raise his, her, their voice and speak up to elected officials. We've been using social media. We've been using Facebook, Twitter, Instagram, but particularly Facebook and Twitter, because those are the tools that are mostly effective to communicate with elected officials. We've been organizing tweet storms and also live conversations via Facebook to engage the community to learn about what's happening, making sure that people understand that none of the bills that Mony just explained are not lost yet. So we want to prevent people to be victims of scams, but also allies like such as you tuning into this webinar to understand that there is no immigration law right now, no new immigration law that have passed Congress. These are bills that are still on the table, under discussion, and maybe some won't make it because there is no enough support for a vote to advance the bills. Text messages, that's another way to communicate. Everyone in this webinar is based in the Southeast, and you know that access to internet is not reliable in the South. Not everyone has access to connectivity to a smartphone. So text messages continue to be a very effective tool for Alianza Americas as well to share our messages, our graphics, and our sample messages to communicate with elected officials or with other people interested in taking action. We've been also organizing call-in days, calling the elected officials' offices, members of Congress offices, to make sure that when there is a date when they are going to be voting on a next COVID bill, or they are voting in favor of one of the bills that immigration bills that Mony just mentioned, that we let them know that we want them to support, but also communicating that we want them to remove any harmful provision that will exclude people, such as the bars included in HR 6 and the U.S. Citizenship Act. Emails continue to be effective to mobilize allies, but also to communicate our demands to the media. We have been writing and signing petitions. Soon I'm going to be sharing in the chat one of our petitions, and we have been as well organizing workshops and, as I said, weekly calls. Next slide, Judith. How much time I have, just to make sure that I cover the essential.
Like 3 minutes.
Okay, good. So who we've been pressuring? The leadership in Congress, meaning Leader Pelosi, Leader Schumer, and any other elected officials who currently have are in positions of more power, such as serving, like Mony mentioned. Also putting pressure on President Biden, Vice President Harris, and Secretary of Homeland Security Alejandro Mayorkas. Next slide. And here are a set of tools that we have been using. We can scroll a little bit faster here. This is a sample. You will have all of these tools. The sample message that we have used in one of the days of action. We also have, next slide, please. Next, Twitter, sample Twitter tweet messages that we have used during tweet storms, directed to Schumer, Pelosi, Durbin. Next slide, please. The Facebook post. We have also created graphics to highlight that all of the actions that we're taking are within our 100 days of action and concrete as for our members of Congress. Next slide, please. Text messages, as I said, brief, to the point. What do we want them to do, and to who we are directing those text messages? And for that, we are partnering with presente.org, who is an organization that mobilizes using e-organizing tools and also text messages, and they have been a key partner in our effort. Next slide, please. And as I said, the sample email. And I think that's the last one to give the mic to Joaquin. Thank you very much.
Yes, thank you, Yanira and Mony, for that really wonderful comprehensive look at the immigration policy and what action steps we all can take currently to change the conditions that are impacting our people. Yesterday was Transgender Day of Visibility, so we wanted to close highlighting specifically trans folks in detention who have been severely impacted by policy and treatment in the detention centers. So I wanted to bring up Roxana Hernandez and Johanna Medina, who were two transgender women from Central America, asylum seekers living with HIV, who passed in 2018 and 2019, about a year apart, due to the neglect of ICE and the conditions in the detention centers. They both were denied medical treatment and care. Witnesses both talked about seeing their health deteriorate and them seeking out and specifically requesting medical treatment. In the end, they were both transferred to hospitals and passed there, which also allowed ICE to distance themselves from being at fault, and that accountability. And in the sort of press releases that followed, put a lot of blame on the individuals who were neglected. Roxana specifically, they said that she died from cardiac arrest, and an independent autopsy showed that she died from dehydration and complication of HIV. And really thinking about the conditions of these places and how traumatic they can be to the body, specifically for people who are living with HIV who continue to face intense neglect in these centers. Familia TQLM, I'll speak a little bit to their campaigns, are really trying to highlight and uplift their names and their legacy to free trans folks from detention centers as well. Next slide. So this was a report that came out in 2013, and I did want to share this. I'm going to put the link in the chat that spoke to specifically people living with HIV in immigration detention centers and their really awful conditions and neglect that were occurring. And I wanted to share these names as well who were impacted. And this was in 2013, highlighting years of neglect. And, we just shared the names of folks who passed in 2018 and 19. And we see that this is an ongoing issue. There really has not been any progress, any care that's been changed. So thinking about what is happening, that people are continuing to speak out, and through multiple administrations that we still have not seen the care granted to folks living with HIV and detained as well. And here was in March 2020, so sort of the most recent update for folks impacted. Immigration Equality filed a complaint on behalf of 6 people living with HIV in detention center who were facing COVID, and they were filing for their release, sort of a humanitarian health release from the detention centers. They all were eligible for parole. They all had eligible sponsors, and they were still being denied release. And as you can see in the complaint, they're specifically speaking to deficient treatment. People are not giving medical care or given insufficient care. People are often transferred between different centers and their medical records are lagging, or they're giving only 2 out of 3 of the medications they need. And overall, there's just a lack of access to specialists, to labs, and overall unhygienic conditions. Next slide. And so from Familia TQLM, they have an end trans detention campaign. So they're actually sharing some testimony from folks who are impacted as well. So this is on their Instagram. I also put their website at the bottom of the screen. So you can see people are speaking out, continue to, again, over years to share their experiences and really call for collective action on behalf of the folks who are impacted. Next slide. And here is another link. Let me put this also in the chat as another call to action on behalf of Familia to, again, release trans people from detention center. We know that people cannot get care, that the conditions are really dire and people continue to face neglect. And so they have an end trans detention campaign. We encourage you to read these resources, to sign on, to share with your community, and really think broadly. Here's the policy that's happening. How are people being affected inside? Here are some specific cases. And so really just want to uplift what's happening, the work on the ground, and get as many people plugged in to help people find the safety that they deserve outside of these spaces. So just a quick close to bring some attention to folks, how they're directly impacted. Judith put my email in the chat. Happy to talk more about this at any point and continue to connect people to resources. And just grateful to share a little bit about this work and be in space with all of y'all.
Thanks so much. And it looks like we're at time, but I did share Joaquin's email. Yanira's email is in the chat. Matt has my email, which I can also throw in there in case someone has any additional questions or wants more information regarding some of these bills, some of these calls to action. If you want to join the efforts over at Alianza Americas, they're always accepting new members. We're a member of Alianza, and let me tell you, their weekly strategy calls are so important for community members to come in and sort of hear a comprehensive look of what's happening in this landscape, because things are changing all the time. So we want to thank everyone, especially over at NCAN. They're our forever partners. So I'll turn it back to you, Matt.
Awesome. Well, thank y'all so much for this really important conversation. As Judith mentioned, I think there's a lot of resources that we'll be able to share. So for anybody who was on the call and registered, we'll be sure to pass those out with email with the link to the recording for today. But with that, I think we are all set. Y'all have a wonderful rest of your Thursday, and just keep a lookout for an email later today. But y'all have a good one.